Do you see it?
Yep, I
Perfect.
see it. Yep, we'll just wing it, and hopefully he'll join. I messaged him on WhatsApp as well, so hopefully everything's okay.
Yes, I will also
we can bring people in, and then I'll just let them know we're just waiting for a few more people before we get started, because it's really, we need all the new people to come.
Yes, I'm seeing a lot of the regular folks. I'm seeing Dr. Ayn Haran, Adrian Selby. Yeah.
Okay, we'll just bring everyone in, and then I'll just say hang tight for a couple minutes while we...
No problem.
Hi, Leonie.
Hi, how are you?
How are you?
Good. Settling into snowy Alberta.
You know, I just heard yesterday that you are now the section chief for pediatric palliative care in Calgary. Have I got it right?
Yes. Yeah.
Fantastic. Congratulations.
Thanks. Yeah. And the director of the Rotor Flames House, which is great.
Oh, fantastic. I'm so glad.
So I'll come up and see you all soon.
Yeah, can you see me?
No, I think your camera's off. Hi, Sharon.
You know what?
There you go.
Hi.
Hi.
Hi, Sharon.
Hi.
Hi, everybody. I know we're running a few minutes behind. We're just waiting a minute or two to see if Jose is able to join us, and hopefully a few more of our new folks come in. So if you don't mind just hanging tight for another minute or two, and then we'll get started. Welcome, Michael. Nice to see you. I see.
You too.
We're so glad to have Edmonton and Winnipeg joining us. I'm not sure if any Toronto folks are on as well, but there's going to be a few folks from U of T, which is also great. And if Jose doesn't make it in the next minute or two, we'll just get started, and he can just join us when he can. Hi, Nicholas.
Hi there. Can you hear me?
Yes. Yeah.
Trying to open the meeting here, but
welcome. We're just kind of waiting a minute or two to see if any other folks roll in, and hopefully Jose will be able to join us as well. Hi, Harvey. Thanks for being here. We're just grouping together, and give it another minute or two. Sorry for the delay. That's too bad, Alan. But thanks for being here. So can you hear us? Hopefully. Yes, I'm assuming you can. We just can't hear you. Perfect. Nice to see lots of familiar Journal Watch contributors, as well as lots of new people. So thanks for being here. Nicholas, remind me which program you're in. Are you in Edmonton?
No, actually, I'm in Toronto.
Great. Yes.
I was formerly at St. Michael's, and now I've joined the Princess Margaret team as of the past summer. So
great. Yes, I'm sorry, I forgot you were one of the Toronto folks. That's wonderful.
Yeah, I mean, I did most of my training in Ottawa, actually, though. So
right.
A little bit.
Great. So maybe Aaliyah, maybe we'll just get started with the slide deck, and then you're recording this session, right? So we can send out the recording and the slides to the rest of the people who aren't able to join us.
Yes, for sure. Okay,
great.
I'll be here. Just let me know next, like usual.
Sounds good. Yeah, you can go on to the next slide. So welcome, everybody. We wanted to have kind of this onboarding session for all of our new Journal Watch contributors, and also to regroup with all of you who've been coming up on 2 years, I think, in December, part of Journal Watch from the origins, shall we say. So by way of background, Jose and I, as a collaboration initially between Queen's University Palliative Medicine and McMaster program, came together to look at how we could help our divisions and then across Canada, people who are part of the LEAP facilitator network and who are practicing kind of generalist palliative care, stay up to date with the literature. And lots of folks aren't members of academic divisions that we all have the privilege of being part of, and so it's not, they don't have the same type of opportunities to really think about what's happening in palliative care and what types of things might change our practice. And so this wasn't meant to be like a rigorous critical appraisal review type program of journals, but really to look at all different types of publications, some more research-based articles, opinion-based articles, consensus guidelines, to really think about what is impactful on our practice and what's going to shape the way we do care in palliative care. So that was kind of the origins, and we always had a goal of wanting to expand the Journal Watch program, but wanted to kind of get it up off its feet. And so that's the place we're in now, that it's actually, and we'll show you some slides, has become, there's uptake actually internationally, as well as across Canada for the program. And we're really excited to expand and have more contributors and work together with all of you to think about what are the best processes in place to facilitate all of us being able to contribute, and that it not be like cumbersome for everybody, because it's obviously the more people we have, the more it is to coordinate. So we want to make it the best process possible. So we thought, just by way of agenda, we'll go through a little bit of the background, which I've kind of given a high-level summary of right now, talk about our goals, what we've been doing, and then really discuss with you how you think we might do things going forward. If you have thoughts or suggestions, and some of you who've been part of Journal Watch for the last couple of years will probably have some good ideas about how we can improve it as well based on your experiences. And then we'll talk a little bit about timelines and leave lots of time for questions. Next slide, please. You can keep going, Aaliyah, thanks. So Journal Watch is actually part of the Palliative Care Echo project, which is, has a whole series of components. So there's a series on communities of practice. We have standalone webinars, quality improvement series, and then Journal Watch is part of that overall project. Can keep going. So our goal, as we've kind of discussed, is really to highlight and raise awareness of noteworthy recently published articles in peer-reviewed journals. And we will look at cross palliative care journals as well as general medical journals and policy type public health journals to see what might be relevant. And we bring these articles to the attention of our targeted audience by live webinars. So where we present, we've done anything from 3 to 5 articles, and we can talk about that. It's really hard to have a robust discussion when we're doing 5 articles, ideally 3 to 4. And the episode, the webinar is simultaneously recorded and then made into a podcast that's available online later. And we've had lots of uptake on the podcast at an international level in particular. So as I said, it was initially a collaboration between Palliative Canada, McMaster, and Queen's, and now we've broadened it to include, very excitedly to have you all here, McGill, U of T, University of Manitoba, Calgary, and University of Alberta. So welcome, and thank you for being willing to be part of this. Pallium's role, so Pallium oversees Journal Watch, organizes all of the sessions, including the webinars, provides the management and IT support, records, and makes these sessions available into the podcasts for downloading, and manages the website of all of this. So that's been fantastic. The webinars themselves are 60 minutes. We aim to present for 45 minutes, with leaving time for discussion after each of the articles for webinar participants, as well as dialogue amongst the guest panelists. So there's usually 4 featured articles, and we have a presentation, kind of a summary of the article, and may include a brief review of the methodology, what the key findings were, and over about 5 to 6 minutes. And then we have a discussion with the panelists of 4 to 5 minutes. So we have usually 2 co-hosts, which so far has been Jose and I, which we're hoping to expand to include some additional editors who hopefully will be joining the team. So Jose and I have been the main editors, and then 2 guest panelists. So each of you, as folks who submit articles, if one of your articles is selected, we will invite you to see if you can join us and be part of the panel to discuss the article and contribute to all of the other articles that we're presenting as well. So we have so many really great articles that get submitted to us that we pick the ones that we think are going to be most interesting for high quality, but also will engage with this type of broad audience. And then we also have honorable mentions at the end of articles that we feel really everyone should take time to read, but we don't have time to present in the webinar format. So as I've said earlier, it's not meant to be a journal club with in-depth critical appraisal, but really that like, what about this is going to change our practice, and what might be controversial, and bring in, if we can, sometimes some other specialists to contribute to that dialogue as needed. Next slide, please. So our target audience so far is really an interprofessional palliative care, primary level palliative care to facilitate, as I said, people who are on the ground doing that primary level care across the country. Often they're people who've taken LEAP courses, and this is a way for them to kind of stay current with what's happening in palliative care. The LEAP facilitators as well are all invited. Any type of healthcare planners and managers who may benefit from understanding what's happening in palliative care, and undergrad and postgrad trainees across different health professions. And then our secondary target audience is palliative care professionals across all disciplines, of course. Next slide, please. So I think we've talked a little bit about this, so I won't dwell on it too much, but our faculty are palliative care clinicians and researchers who have academic appointments and themselves have experience with critical appraisal of palliative care literature and developing best practices. It is important to have an affiliation with an academic institution because it's been actually difficult to get access to journals and the things that we're supposed to be regularly monitoring without an affiliation with a university. And to date, what we've done is have faculty from each site join into teams. There have been some individuals who wanted to work and monitor the journals by themselves, which is also fine. But each team or individual has been assigned to 2 or 3 of the journals from the list, and will review. We've been doing it every second month, so they will review kind of the last 2 months of journals. So it really is meant to be current publications as opposed to older publications. And we, each of the faculty kind of monitor the journals and then will submit articles that they think are noteworthy and practice changing to the editorial team with a kind of there's a standardized template that we use for you to put in the DOI and why you think this is an important article for presentation or honorable mention. And then the editorial team reviews all of those submissions and has a standardized criteria to evaluate what would be best to bring forward for the webinars. Next slide, please. So as I've said, this is kind of stuff we've already covered, but just to highlight the program support team at Pallium. Aaliyah is with us today, and Diana Vinci is not able to be with us this afternoon, but she is one of the key leads from Pallium for making all of this possible. And we're really excited, hopefully, to have a couple of new editors joining the team. And if any of you are really keen to be part of the editorial team, to please let us know. Next slide, please. Keep going. I think we talked about this. So I think it is important to say, and I'm just checking if Jose is with us. Do you know if he's joined, Aaliyah?
I think he's just come in.
Okay, there you are, Jose. Nice.
Hi, sorry.
Thank you for being here.
I'm sorry I'm late.
It's good. It's good. I just got started, and I was going to ask you if you want to talk about what's a noteworthy article.
Sure.
Thank you.
I can see some friendly faces. I think I can see Gary. I can see Ingrid. Fantastic. Hi, everyone. Sorry I was late. We just having a bit of a crisis with my father-in-law. So just on the call with the healthcare professionals in Portugal. So a noteworthy article. So I don't know if Leonie's already mentioned about what the goal is of the journal watch. Have you covered that already, Leonie?
Yep.
Yeah, okay, perfect. So we're looking for papers or manuscripts that will change the way we think about something, whether it be clinical care, service organization, education, learning, quality improvement, public health approach, or advocacy. Either changes the way we do something or think about it, or confirms what we're doing. So, for example, a few months ago, we did a study on mirtazapine that challenged our thinking that it improves appetite. So those are sort of papers that we're looking for. We've got to find a balance here between who the target audience is. I think it's easy for us to look for papers that interest us as palliative care specialists, which is understandable. So we don't want to just ignore that target group of palliative care specialists, but we also want to gear this towards generalists. So those who provide primary level or generalist level palliative care. So it's always that trying to find that balance. It'll be easy to go into detail on papers on methadone, etc. But if a lot of the audience, and remember a lot of the audience are folks who've done LEAP courses across the country, and so they're not palliative care specialists. So there's no hard rule about what a noteworthy article is, but try to find that balance. And anything that confirms what we're doing or challenges our thinking across a number of domains.
Elia's advancing the slides, Jose. Next slide, please.
Perfect. So focus obviously on palliative care, and papers around the palliative care approach would be very helpful. Relevant to the Canadian healthcare system, although I think increasingly we're beginning to see papers that may not necessarily only be relevant to the Canadian healthcare system, but nationally or internationally. We've got more and more people joining us from other countries. As we said, confirm or add evidence or refute current practices. Now, here's an important piece. It's got to be well written and the research methods are going to be solid. So this is not a journal club. It's not a detailed critique or a detailed exploration of a paper. So we make the assumption that the faculty yourselves will screen it beforehand. So before you suggest it to the editorial team, you would have screened it. And you said, yep, this is a good paper, it's well written, that yes, the research methods are robust. They may have some limitations, but generally they're robust, before suggesting it to the editorial team. Because we're not going to go through it in a detail discussion when we're presenting it, and when you all take turns presenting it with us. Good. We've got English and French articles. Every now and again, there's actually, I'm just learning now, there's a very big Spanish literature base as well. So I'm trying to keep an eye on that. If that is relevant, then maybe we can introduce that as well. But obviously presented in English. Or everything's presented in English, by the way, for the time being.
Go ahead, Ingrid.
Yeah, you know what? I recently, over the last few years, have also noticed that there are some pretty good German articles. And, you know, we have somebody like Daniela who can help us translate it properly and so on. So I don't know how far we want to go because, you know, we really could go.
Yeah,
well,
Ingrid,
I don't know. You guys decide.
I think if you find a paper that's really solid from another language, then I think bring it in. And if someone can present it, obviously translate it and bring it in. Because I've been surprised at some really good papers out there in other languages.
I agree.
I mean, I shouldn't be surprised, but I guess I'm surprised because we didn't realize it. We don't bring it to the fore as much as we should. Next, please. Thanks, Ingrid. And folks, just stop me anytime. If you've got a question or comment. Oh, good. Someone in Spanish. So the selection or the process that we've taken so far is the faculty monitor the assigned journals, identify noteworthy articles, and if the time comes up for the next episode and there's nothing there that's of interest to you, then just send a note to the Pallium team saying none in this issue of interest, just so we know that you're monitoring it and we can tick it off. The teams review these and select articles to submit to Echo support. It's actually Pallium Echo support. So what's been happening is we've assigned teams, and selection have largely been done by teams. We've got one or two individuals that are working alone, and so they make up their own team. But generally, they've been teams of 2, 3, 4, 5 people. The individuals find the articles, and then amongst themselves, they decide if there's one that is really worthwhile highlighting. They select that one, and then they send it into the Pallium support team. And then that's Pallium support team collates all of these and then brings it to the editorial team. And so far, the editorial team has been Leonie, myself, and we've got someone from the Pallium team that joins us. But we're hoping, as we're going to come back to shortly, to make this larger and to make an editorial team of 4 or 5 people, and with some rotation occurring. Next, please.
Jose, just a quick question on that. I just am wondering, you were saying on the previous slide that articles will be selected for presentation, but what happens about the ones that don't make it to presentation, but might still be really useful articles?
Yeah, so sorry, we haven't come to that. We're going to come to that, but absolutely.
Okay.
No, great question. So it ends up at 3 categories. The one is presentation. So we used to select 5 because there's so much, there's so much good stuff. So we used to select 5. And then we got some feedback from participants saying they liked the discussions and the 5 didn't give enough time for discussion. And participants are able to interact by chat and pose questions. So anyway, so we brought it down to 4. That's category number 1. Category number 2 is honorable mentions. So those that we think are really noteworthy but haven't made it to the presentation, the group, are honorable mentions. And so we mention them in a slide or 2 during the presentations. And all of these, by the way, they're recorded. So all these sessions, these episodes are recorded. Those recordings are made available for free downloading, and the numbers are getting bigger and bigger. And then each one's turned into a podcast as well. And the podcasts are shortened. The production team at Pallium are able to shorten it up, clean it up nicely, and make it like very professional podcasts. So to answer your question, honorable mentions. So there's a list of honorable mentions, and those are posted on the website as well. There's a group there that doesn't make it at all. So neither presented nor listed as honorable mentions. And we can have a discussion about this in maybe in a few months' time, whether we still list them somewhere. It could be like presented, honorable mentions, and other noteworthy ones.
And we were just talking yesterday, or a few days ago, Jose, that the spreadsheet where we collect all the articles, we could share that with the whole faculty so that you would get that list and be able to see all of them as well.
Right. Yeah, and not duplicate.
Yeah. Yeah, and we'll come back to that shortly. We're looking at some sort of like a voting system as well. So it becomes like a bigger, larger group of people. Next, please. Leonie, tell me when you're ready to jump in. I'll just keep going until you jump in, please.
Sounds good.
Good stuff. So there's a website. That's the URL for the website, echopalliative.com. It is part of Pallium. I don't know if you folks know about the ECHO project. Some of you may. You may be in groups or organizations that are partnering with Pallium as an ECHO partner. ECHO's been supported at the moment. So ECHO started in the early 2000s in New Mexico. Basically, what it was, it's tele-mentoring project. It started in the early 2000s when, sorry, just a minute. It started in the early 2000s when there was an outbreak. I think it was hepatitis C in New Mexico, and a lot of the small communities didn't have any experts who knew how to handle that, and so they set up the system of virtual support and telementoring, where a specialist in New Mexico, in Albuquerque, would then support them. And that project now has become really big. It's now international, and palliative care folks have joined in. And so we've developed, Pallium has developed a super hub with a whole lot of partners around Canada. So we've got different organizations that have become ECHO hubs, with Pallium supporting them as a super hub. And this palliative journal is part of that, and it's funded by Health Canada. So the ECHO project is funded by Health Canada, just so you know. Pallium's LEAP program receives almost no funding from Health Canada. In fact, no funding, except for one small little area. But anyways, that's just to give you a bit of a background. This is the website, so you can go to that. You may go into the Pallium website and then find the Journal Watch. Just look for the link that links you to this, the more formal Journal Club, or sorry, Journal Watch website. Next, please.
We can get Aaliyah or Diana to also just send out the link and follow up to this session as well.
Yeah, and then so this is just to show that the sessions are posted online, so you can go and watch them, and then also the podcasts, and you can download the podcast through Apple Podcasts or Spotify. Next, please. This is what it looks like. If you go to the website, you'll see the particular episode. We call them episodes. Well, yeah, they're called sessions, but we generally call them episodes. This is September 2023. Here are the featured articles. These are the ones that were actually presented. If you open it up and you look at the PowerPoint, at the bottom, you'll see there's a link there, view additional articles of interest. Those are the honorable mentions, Ingrid. You're asking what about those that are not presented? So they're listed here, and they're also listed in the actual slides. And people can download these slides, so that they've got the links for them. Good. Next, please. Just same thing, just in a different presentation form. Good. So results to date, actually we've delivered, I think 9, or is it 10? Is it 9 or 10?
I thought it was 10.
I thought it was 10 as well.
Yeah.
We've been doing it every 2 months. There's a fair amount of work that happens, apart from monitoring, and then organizing the sessions, and then the post-session production that occurs to put it online, and then also to create the podcasts. But I think with a big team that we're now becoming, with a big group, one of the things we're looking at is maybe turning this into perhaps even monthly. But let's just first see how things go every 2 months, and then as a group we can make a decision if we want to go 2 monthly. This is a little a heat map of where people are signing in and downloading these sessions or the podcasts. Attendances are the number of people that have joined us. So
to the live webinars.
To the live webinars, exactly.
Yeah.
And then the recording views, you can see, is about 4 to 5 times more. And the number of podcast downloads, that's going up exponentially. So the last count, I think, was actually just over about 4,000.
Yeah, it's pretty cool. Look at that. It's all like really all over the world now that people are accessing this format. It's quite cool. But there's definitely a need for it, so that's great.
Yeah. And again, remember, this is a journal watch, right? It's not a journal club. And this is extremely important. You as faculty have to do the screening of whether you think it's robust from a methods section. I mean, there's some filters, right? If you're working as a team, when you take it to a team, there's a filter there. Then when you bring it to the editorial team, there's another filter. But the assumption is that there's been a detailed critique of the methods used and the quality of the manuscript itself beforehand. Okay, next, please. Okay, so what do we get out of it? Well, there's I think the first one up there that's not even listed there is I think we help spread together as a team, as a group, disseminate literature. As we all know, it sometimes takes forever. And I think the other added challenge these days is there's so many journals. I'm finding it very difficult, and I'm not keeping track anymore. So I'm actually finding that the journal club is helping me personally keep up to speed with the growing literature base, and I think you'll experience the same. As we said, there's visibility. It counts for scholarship, so it becomes part of a scholarship. And for any of you who are looking at promotion, if you've got academic appointments and promotion, one of the criteria for promotion is often impact nationally or internationally. Well, you can list this one as one of them, as you can see. And then many of you are already part of the Pallium community, so you become part of that. And if you want to add anything else, Leonie?
No, thanks.
I think that covers it. Okay,
yeah.
Next, please. Okay, so what's our responsibility? So there's faculty, there's the editorial team, and then there's the Pallium Journal Watch office. So for faculty, monitor the assigned journals regularly. So if you can figure out how, you get a notice from whatever the journal is as soon as the new issue comes in, or you go in every now and again if they've got an e-publication and just watch it and just monitor what's coming up, because we can also present anything that's come in through e-publishing before it gets published in an actual a paper version. So read every new issue, identify articles that are noteworthy, select the ones you think are noteworthy, bring it to the team if you're working in a team or assigned to a team. As a team, decide which ones to present, and then submit the selection. And so far, it's simply just a link, and you can use simply the PubMed link. Just the link when you've got the article, you can just forward the link with a statement about why you think that this paper is worth it. Afterwards, once we've chosen a paper as either to be presented or as a honorable mention, then we'll ask folks to just do a more deeper, a more not extensive, but like a 1 or 2 pager summary of the paper, the research. If it's a research paper, the goals, the aims, and then the methods and the key findings.
And we have a template that we send to you that you just fill in for your article at that point.
Yeah. And then participate as guest panelists. So the presentations, we use a panel approach. Ideally 4 people. We've done some with 3, but 4 just gives more of a conversation. And these presentations, we try and make them informal. The actual paper or the manuscript, sorry, Lynn Meadows keeps telling me I've got to call these manuscripts and not papers. The manuscripts that we present, it's quite short. It's we've got about 5 to 7 minutes to present, and then open for discussion. And then the panel shares their thoughts on it, their experiences, different perspectives on it. So we'd ask you to participate if one of the chosen, if your article is selected as one to present, then you may be asked to join the panel. And the idea is that everyone gets a turn to do 1 or 2 per year. If we're doing it every month, then you might get 3 or 4 chances to participate as a panel member. For the editorial team, is to oversee the overall quality of the Journal Watch. The big job is to go through all the papers that are sent to us. We read them, and then we select which ones are the one we're going to be presenting, and which are the ones that are going to be honorable mentions, and which ones are we put aside. And hopefully with the team getting bigger and the editorial team going to 4 people, I think that'll help the process and also reduce the bias as well that could be inherent in only 2 people reviewing it. That's about it. The Journal Watch office, the team collates, they'll send out reminders. They will send out again the forms that are used if you haven't saved a template. They collate it all together. They organize it for the editorial team to review. They work with us during the selection process. They'll organize the sessions, they'll market the sessions, they'll record the sessions. So all that's done by the back office. So that helps us a lot. I mean, we're all got lots on our plates. So the team does an amazing job. Any questions so far? Here we go. So timelines. So ideally about 4 weeks before the next session. We've been doing 3 weeks, but 4 weeks would be better. Some folks have told us in the past that giving people only 3 weeks, when we send out an invitation, say, hey, we've chosen 1 or 2 of your selections to be presented. Could you be part of the panel? Some folks have said 3 weeks are not enough, that they, with their busy schedules, that might not be enough. So we thought, okay, maybe 4 weeks. And if you can't, then not a problem. Someone else will present on your behalf. Okay. So 4 weeks before the next episode, you'll send in. Sharon?
Hi, just to clarify, do we submit articles as a team or as individual team members?
Okay, as a team, but
As a team. Mm-hmm.
As a team, but we've got a few questions for the group now that we're bigger. One of the questions we've got is, do we continue working as teams? Actually, let's talk about it now. Do we continue working as teams, or would you prefer to work as individuals? So there's pros and cons to each of those. The advantage of working as a team, obviously, is that you've now got 2, 3, 4 other colleagues that you can then bounce ideas by. And for the process, I think it's good because there's a screening that happens there already. The disadvantage of it is that it means that folks have to organize a meeting and come together. Depending on where they are, there's some teams that come together in person, others that do it virtually. So that's an extra layer, an extra piece of work that has to happen.
And sorry, Jose, we did, like, for programs that have large numbers of participants, like U of A will have quite a few of you. What we had done historically is break into smaller groups, so just for more efficiency. So we had like 2 to 3 or 4 people just for ease, and so you wouldn't necessarily have to all work together in one large group. That wouldn't be what we've traditionally done. But yeah, as we'll talk about whether that's the right approach or not.
Yeah, so think about that, and then we can come back to that. And we don't have to make a decision tonight. We could maybe do it just by email, but just think about it. Okay, next, please. It's usually, Sharon, to answer your question, usually by team, except for those individuals that are working on their own. Chris Klinger, for example, is a one-man team. He's been monitoring all the public health type of journals, so Healthcare Quarterly. So here's a list of the journals that we've been monitoring. So in palliative care, you can see the list there, and you might spot or you can maybe see a gap there. So part of the process tonight is to see if you identify any gap of a journal that you think really makes sense. The one that we haven't been featuring so far has been Annals of Palliative Care, and I'm beginning to see more and more papers coming from Annals. But look at that list. The cancer list is on the right. and the others as well on the right. So there was someone that's got a question. Oh, Aingeron, you're one of those that have been sort of assigned more to a one person team. So thanks for all the work you've been doing. So there's another process here where we're looking for articles related to palliative and end-of-life care that are not listed here. So in all these other journals, because every now and again something pops up. So far, it's been a bit of an informal process. We have actually featured some papers, some manuscripts that are not listed in any of these, and they pop up through our various faculty-related work or studies that we're doing and reviews that we're doing, so they can pop up. So feel free, if any of those are, if you spot any of those, to bring them to the fore. Okay, so you might really have seen a gap or two. I mean, it's impossible to do all of them. We did have education journals, and we've removed the education journals. And we hadn't featured any. I tend to keep an eye on some of those. So BMC, medical education, medical teacher, medical educator. Oh, New England Journal of Medicine. It's supposed to be there. Sorry. Yes, we do have that one. We need to add that to the list. Sorry. We are monitoring it. Must have been an error as we typed it up, as I typed it up. Sorry. Yes, so we will add New England Journal. We are monitoring it. Okay, next, please. So the big question is about all these other fields, nephrology, respirology, cardiology, etc. So I think going forward, we're going to try to find a way of, someone has suggested to me that AI can be helpful for us to monitor these. Someone who's become very acquainted with ChatGPT version 4, nothing below, they tend to hallucinate, I'm told, but 4, so we're exploring that in the background to see if that's something that could just help us. If anyone's got any thoughts, ideas on how we can do this, please, would welcome any ideas. We don't have a librarian that's supporting the group, so we have to find our own way of doing this. Next, please.
Ingrid, go ahead.
Yeah, just a question. Would it perhaps be a little bit more efficient if teams were kind of assigned a group of journals? Because I am not quite sure. Are you wanting all teams to do everything?
No.
No. Sorry.
Okay,
no,
good.
Sorry, folks. I should have said it.
We did say that.
I thought you covered it. Yeah.
Each team is assigned like a number of journals. It's usually 2
perfect.
or 3. So you're only monitoring your assigned journals, 1, 2, or 3 kind of,
Wonderful. Thank you. I was just thinking,
No.
Well, this is one of the reasons why we've got the journal watch going.
Exactly.
Is that it reduces the burden on each one of us to keep looking at all of these things. Yeah.
I thought you wanted to make us the sacrificial lambs for all palliative care practitioners in the world. So thank you.
No, that's a great question. Sorry, we sometimes take things for granted. We don't make it explicit, but that is just 2 or 3. One of the advantages of going individual is that we can maybe then end up with only 1 or 2 each. That would be one of the advantages of instead of working as teams, working individually. These have been the teams so far. You may know some of the folks, others you may not. We've largely been collaborating with. It was with Queen's when Leonie was there, and we'll continue with Queen's obviously, and at McMaster. So we thought we'll give it about a year and a half to test this out, see if it's feasible, figure out how to figure out all the operational stuff, and then make it bigger. So the intent was from the beginning to make it bigger, but we first wanted to get things up and running. Good. These are the journals. So Ingrid, to your question, here's an example of the allocation of the journals.
We have a big master spreadsheet that has everyone's assignments and how often they're published and everything, so it's easy for us all to know what's happening.
And the Pallium team keeps Leah and Diana keep this fantastic spreadsheet for us where we're collecting all the data about how many articles were submitted for each of the journals, when it was, which it's a bar diagram that shows you the number. Let's just say there were, I don't know, 15 from Journal of Palliative Medicine and 3 were presented. We can see that quickly. 5 were honorable mentions, the others were turned down. So it gives us a quick look to see, is there potential bias? But that's how it informed us that there doesn't seem to be much point in monitoring some of the education journals because there's nothing coming through. Okay. And we've tried to distribute it so that one team doesn't have like the 2 or 3 journals that's published every month. We've tried to spread it up so that some teams have got the ones that are frequently published, others that maybe only every 2 months, or others, and so it's a mixture of frequently versus quarterly, for example. So we haven't assigned journals yet. Sharon, and I see Ingrid as well.
Yes, hi. I just want to mention that not all members of our group have a university appointment. That being said, Alberta Health Services has, a broad selection of journals, but that might be a factor in determining which journals get assigned to us.
Perfect. Well, we're thinking of doing a process where we can select the ones we want to do, and we were actually thinking of rotating. So if we decide to go with teams or as individuals, that we would monitor something for, I don't know what the periods would be, like 8 months, 6 or 8 months, and then we switch over if that's what people want. So they get or do it for a year and then switch around after a year. But yeah, so the reason why we've been looking for people with academic appointments is, one, inherent in the role of an academic appointment is the scholarship role, which requires that we are up to speed with critiquing, with critical appraisals of the literature, and 2 is usually got access to the journals. But if we've got 1 or 2 people not joining, and as you're saying from your team that may not have an academic appointment, we try to figure out a way. What we cannot do is we cannot pay for access to the journals, so don't have the funds for that. Ingrid, you're muted.
Right. Too many buttons all at the same time. If we have, I'm just thinking of one of the neurologists that we work with. I think she might want to join. How do we add a new member? And, she would probably come with neurology journals. So how do we let you guys know about that?
So what I love about that is you've just given us now an idea on how we can cover those specialty journals.
Yeah, exactly.
Or just pass the name on to Diana or the team, and then
okay.
And if you want to, in the meantime, reach out to that person and see if they've got any interest.
No, I will. She's very keen. She just missed the deadline to be grandfathered in to write the exams, the palliative care exam, because she works with us now for a number of years. So that's
actually
great.
That could be a nice, I don't know what Leonie thinks, but that could be a nice way of covering these other journals.
Have our champions within specialty areas. Are you talking about Janice?
Yeah.
Janice? Yeah.
Yes, Janice Miyazaki. Yeah.
Yeah, no, that would be great. Like, we have lots of folks who are dual trained or dual practiced, right? Like in nephrology and palliative care and liver disease and palliative care. That would be amazing if they could be if they'd be interested in submitting articles from their specialty field. That'd be fantastic.
I'm thinking of someone like Sarah Davidson in Edmonton as well for nephrology. So Ingrid, if you just want to informally reach out that person and then send the name to the team, so Diana,
Perfect.
and then Diana will, and then we can write up the formal letter of invitation.
Great. Sounds great. Thank you.
Cool. Okay, well, I think we've got a solution or something we can try. Good. Next. So these are the, by university, these are the folks that are now joining us. So we've got University of Toronto, McGill,
Calgary, Alberta, Manitoba, U of T, and
McMaster.
Yeah.
And then we've got Adir in Israel, who's going to be monitoring some of the oncology journals. Next, please. So here's the submission form. So once your article or your manuscript has been accepted for, definitely for presentation, possibly as well for honorable mention, then you're asked to please complete the form. And it's a standardized form. I don't know if you want to walk through it with the folks, Leonie.
I think we can just send it out because we have talked about it a little bit. I'm just thinking we only have a little bit of time left. We could talk about
sure.
the questions around, do we want to do individuals, groups, how we divide up? Yeah,
let's do that. So it's pretty standard. We've tried to create it so that any type of article can be submitted. By the way, it doesn't have to be a study. It can be an opinion paper. It can be a letter to the editor. It can be a position paper, can be a systematic review, anything that's gone through one of these peer review journals. Okay, next. We don't have to. It's pretty straightforward. The referencing style, simply just use the PubMed. If you open PubMed, you see that little button that says cite. That's the standard we're using. Okay, we've already spoken about. So when you're submitting for the research article, just background, methods, key results, discussions, and conclusions, and it's short. There's a limit to the words. And then for any other work, the background, description of the work, discussion, and conclusions. And there's a spot there where you can say why you think that this is an interesting paper, why it merits mention. Okay, next, please. I think with this, we can keep on going with the questions, right, Leonie?
Yeah, I think just let's talk about next steps would be helpful with our last 5 minutes. Yeah.
So over to you.
Oh, can you go back to that? There we go. Yeah. So it would be really great if we could hear from all of you who've been on Journal Watch or new folks about how you think it might work best in terms of doing the journal surveillance. If you prefer to work individually or in teams, like let's just open it up for a bit of a discussion, because certainly we're happy to help facilitate like assigning journals, or we can have people request particular journals. If it's easier, we're also happy to make team assignments, but we really just want it to work for all of you. So what are your thoughts?
Yeah, Vicky, it's interesting you mentioned that, because Leonie and I have been thinking about reaching out to you one-on-one to say, we know you're a specialty area. So, and that's fine. If you want to focus on that, you can focus on that specialty area, the cachexia. I think for you, you're going to have to screen for like what's applicable on a larger scale. You know lots and lots and lots and lots about this field. Think about the more clinicians in the front line, what's really relevant or helpful to them. Everything is probably relevant, but what's really helpful from a practical perspective. A large group of participants that join us are also the LEAP facilitators. So one of the reasons we set up Journal Watch was we've got now over 800 trained LEAP facilitators across the country, and many of them don't have faculty appointments. So this helps them and this keeps them up to speed. So what would be practically helpful? So Vicky, we'll leave it up to you. And if you're not sure, send us what you have, and there is that filter. We might be coming back and say, no, we think this might be too detailed.
Well, you know, this
Specific.
discipline lurches forward in fits and starts, but if it happens to have a new clinical practice guideline or a new recommendation, so the thing that's going through my mind is there was a randomized clinical trial of cachexia therapy recently published in the Journal of Clinical Oncology. And the ASCO guidelines group decided to provide a clinical practice guideline update. So the ASCO clinical practice guidelines have a real-time update function. And so I think perhaps in the instance that we could get another hit in a clinical trial, I could, ring the bell and say there's something happening in the field.
Yeah. And Vicky, if that paper you're mentioning has been published in the last few months, it's okay. Bring it now. If it's, I mean, look, we don't want to go too far back, but even if you think it's really, really relevant and it was in 2023, bring it in.
Well, it's about olanzapine, and they've decided to make a recommendation to trial it. So it's a recommendation for olanzapine. And I just wonder, in the whole palliative care world, olanzapine has been proposed for a lot of different indications. And if that's of interest, I will either highlight the trial or highlight the clinical practice guideline update, whichever.
Perfect.
I'll send those in, and you can use your wisdom to identify whether those are a priority.
Yeah, send us like 2 or 3 that you think this year may. It sounds like you've really got a feel for what we need. So exactly. So send it for Gary. I think had his hand up, and then Sharon has got a proposition. Gary.
Yeah, hello. Nice to see everybody. Yeah, I think Sharon might have preempted me there. With 8 of us in Edmonton, I think naturally falling into 2 groups of 4. Vicky not only brings expertise in cachexia, but also in statistics and analysis of papers that I, could really benefit from. And I think, those groups would have a nice combination of clinical expertise and statistical and publication expertise. So that's kind of how I see it playing out for me. And then just throwing in, I didn't see any journals on pure pain and anesthesia.
Oh, that's painful.
That was the only gap that
you mean you think of something like pain?
Yeah, or
great suggestion.
Papers. Yeah.
Send in the list that you think, Gary, like the top ones, and we can add all the others to how we figure out a process of monitoring these. But if you're volunteering to do one of them, they would be great.
Sure. Well, I guess we can talk amongst if we had a group of 4 doing 2 journals, we could work it out.
Or a group of 3 doing 3, or 4, whatever's easiest. Look, the fewer the number of the teams, the more journals every team has to monitor. And the more people per team, the more hassles you might experience trying to bring teams together, everyone with their busy schedules. So it's up to you. If you think 3's fine, if you prefer 4, let us know. Ingrid, and then I think Harvey made a comment as well. Go for it, Ingrid. No, Ingrid.
No, I just very quickly, just for our Edmonton group, if Janice joins us, perhaps we could divide into 3 different teams, because there could be the neurology group with the German in there. Daniela could do the German articles for us. Look for German journals with interesting things. So just a thought, but I think we'll just have to talk internally. Thanks.
Yeah, and then just send us an email with what groups you've decided on, and if there are particular journals that you want to monitor. We'll have to take that into context with everyone else, of course, but
yeah.
Okay, I'm just looking. There was comments by. Sorry, Jacqueline, I just saw that your name was wrong. We'll make sure we correct that. Apologize. Lo siento.
No problem. Thanks. Gracias.
De nada. Okay. Oh gee, there was one by. Sorry, folks. I haven't been monitoring the. Oh, Yoko Wrigley scans pain journals. Yoko, if that's something that you're interested in and working maybe with Gary, that would be fantastic. Chris, the thanatology. Way back at the beginning of the whole process, we had thought of that, but there's so many others that it becomes really, because there's ethics as well. No one's mentioned the ethics, right? But so I think for the time being, maybe if we can still just maybe not do thanatology yet, unless you come across a paper that's absolutely stunning and changes everyone's thinking. Or if anyone comes across something in ethics, if they're monitoring that, then bring it to the fore. And then there was something, I think was it Harvey? I wonder if some of the new faculty are single. Sure, Harvey, if you're keen on joining someone, that'll be actually nice, and it'll help you make links to colleagues across the country. I'm just thinking, which teams?
So from Winnipeg, I think Michael's on, right? Is Braden on as well? Both of you on the call?
Yep.
Maybe they had to leave.
Yes, hello. Yeah, I'm here.
Wait, can you let us know if you want to work as a team, the two of you, or if you prefer to be individuals reviewing the journals?
I can't speak for Braden, but I'm happy to work as a team.
Yeah, I
Great,
think that
Michael.
I like the idea of the team approach. It seems like that's what you've been doing previously, so we'll probably start there and see how it's going.
And then Nicholas, I think, is the only one on from U of T, correct?
No, it's also me, Jacqueline.
Oh, sorry, Jacqueline. Great. So can you let us know what U of T wants to do? I think Ebru and Kirsten were happy to support, so it maybe makes more sense to be one team, but up to you.
Yeah, we can actually discuss with them first and get you an answer from the four of us. Yeah. Thanks.
So Harvey, do you want to join our colleagues Michael and Braden at University of Manitoba?
Okay, yeah, good. Sounds good.
Nicholas, is it stealing intellectual property if we screen existing journal watches? Yeah, I don't want to get into that one. So I'd rather avoid that. But it doesn't stop you from going through them and finding a paper that you really think is worthwhile highlighting. The New England Journal of Medicine Journal Watch, they screen all the group of New England Journal of Medicine journals, correct? They don't do beyond New England, or do they do?
They actually, my understanding is that they actually do screen broadly, and I've used them because they divide into many subtopics. Sometimes that can be very helpful to look at, and it's fairly current. But which is why I thought of this. But I realized it could cause a delay in identifying current articles if we're waiting for a journal watch to identify them first. But it does help. It does help you find articles if you're looking for something.
Totally. So I mean, if you want to, so I'm doing a similar thing with Progress in Palliative Care. Progress in Palliative Care does that as well. So every now and again, I go pop in there and see, is there anything there that we may have missed or that the groups may have missed? So if you want to do that, it would be fantastic. And even if we do it for 6 months and we see how it goes, if that helps us fill in any gaps so that we don't miss something that is really groundbreaking. Okay. Leonie?
I think just to wrap up, so if you can send in to us preferences on your groups, and I was just typing a note to the Queen's team, but Andy and Julianne, if you can talk to Jean and Emma and let us know if you're all going to be one group, or because Anna and I were with Julianne, so obviously Julianne's now on her own, so we'll need to figure that out. Just let us know, and then any particular journals you want, and then I think Jose will go through and assign journals to people based on what we have, and then send that out to all of you. Does that sound?
So yeah, we'll send everyone this package, the slide deck. Aaliyah, could we please add New England Journal of Medicine to that list of others on that one slide? We'll send it to you, and then if you can send us by an email which your teams that you would like to be in, and a list of like your top choices of journals, and then your like maybe the top 4 that you would like to monitor, and then the second group of 4, for example, so that we can. I'm sure a lot of people will be wanting to monitor the same ones. If we see there's a lot of overlap, then I think we can come back and say maybe we'll do a switch over, like after a year, whatever it is.
Or reduce the number of journals that each team has to look at. You know, if it really starts becoming too much duplication, it's kind of not efficient.
No, exactly. And that's why I think that the teams, again, I'll reiterate what I said, the bigger the team, the more journals each team has to monitor. So a team of 3 to, I think more than 3 or 4 more than 4 will become unwieldy and make it, I think, take away the efficiency. I think 3 is the magic number, but if there's a team of 4, that's fine.
Okay. Any other burning questions?
Yeah, so we're going to broaden the editorial team. Geez, I suddenly had this sinking feeling that we haven't reached out to, I hope someone's reached out to Ingrid and Sharon, or is this a surprise to you?
I spoke to Ingrid, that's good. And Sharon and I were supposed to have a call but haven't found a time. So we're hoping Sharon is going to be excited after this meeting today and really wants to be one of the editors. Right, Sharon?
And if not, Sharon, we can.
No, just kidding.
In all the episodes, there are 2. Well, it's been Leonie and myself that are on it with 1 or 2 guests. But if we're 4, then we'll take turns. And the other thing, as we mentioned, is we're looking at an online platform or program or an app where we can do voting, so that it's not only up to the editorial team, but if people are interested, they can be part of the process. But that's going to come later. We haven't got that up and running yet. The voting system will be for the editorial team first, for the 4 folks. We'll see how that goes. If it works out fine and we've got it running smooth, then we think of maybe opening up to everyone. The only problem is if we open up to everyone, you're going to have to read all the journals. So it loses its efficiency and it adds burden to Ingrid, to your point earlier. So for the time being, we'll leave it at the editorial team and just see how it goes. How we've been doing it is Leonie and I, we go through yay, no, and then and some of them we completely both agree, others we disagree, and then we come up with some consensus thing, and that's how we've been doing it.
Sorry, just to wrap up, because I'm trying to be mindful of everyone's time. Thank you so much, everyone, for joining us. We will definitely be sharing the deck with you, and also an example of the article submission form. And then we will keep in touch about the evolving teams and how that's going to be reframed. If you have any inquiries, or you know anyone that would be interested in joining the Journal Watch that you would like to recommend to us, the ECHO team, please email Diana. I have put her name in the chat, but also when I send out the email, she will be CC'd on the email, and it's Diana and I over here at Pallium. And as best you can, hit reply all, because that just keeps us both in the loop, and that way we can get back to you and resolve things in a timely manner. Yes, Ingrid, I think you want to say something.
Yeah, I just wanted to really say, Leonie, and just say, I think this is a fantastic idea. Good for you guys, and thanks for moving us all forward.
No, and thanks for joining. Thanks so much for joining. We've been wanting to, this is a dream. It's been like a 2-year dream of like faculty across the country coming together. We were just scared of opening up to everyone at the beginning because we thought, okay, if this flops, if this doesn't work out, this is going to be like not very good. So this is the right time now. We've got a sense that it's good, it's exciting, and the more people, the more perspectives and variety we get. Who knows? We'll see what happens. I'm hoping we can get to monthly. The stumbling block at the moment is just bandwidth, in terms of this is a lot of work for the Pallium team, but we'll see how it goes. But thank you. Thanks, Ingrid.
Yeah, thanks, everybody. It's very exciting to have you all part of this.
Perfect. Oh, Chris, can you keep an eye on the IHPC then?
Great. Good. Thanks.
Thanks, everyone.
Take care.
Bye-bye. Could you hold Leonie?
Yeah.
Perfect. Perfect. I'm so sorry I was late.
No worries. I just
We're
sorry.
having such a big debate. So my father-in-law, it's been like a week of, so he's got severe dementia and severe Parkinson's.
Yeah.
And there was this whole debate about he's not swallowing now. So a big family thing, and we've got to put in the tubes and all that.
Right.
And Odette and I think, no.
Right.
So we said, okay, look, we can do a trial, but if it's not tolerating it, then he's got to remove that. Anyway, he's clearly not tolerating it, but now the nursing home do not want to remove it. And they've got him in gloves, they've got him tied down with gloves because he's trying to remove it.
Right.
He's obviously aspirating. And so anyway, so we were just with Odette's sister on the phone. She's
so
there.
Sorry. Oh dear.
I'm sorry I was late. Yeah.
All good. I just dove in. I figured you'd join us if you could, and I just keep going. It was all good. Yeah.
You're amazing, Leonie.
I
love working. It's fantastic working with you.
It's fun. I love the enthusiasm of the Edmonton team. I think that they're looking for something positive because it's been kind of crappy for them lately, right? So it's nice to see them come together in this way because I think it's been tough go for them. So that was good to see.
Yeah, and it's a team with amazing pedigree.
Yeah, exactly.
It's fantastic. I mean, it's amazing to see. Yeah, I'm hoping we can get into monthly.
Yeah, that would be great down the road, and we'll see if Sharon sends us an email saying, I'm not sure.
I mean, as a slide came up, I thought, oh gosh, was I supposed to have reached out? I didn't.
No. I reached out to both of them, and Sharon said she was interested, and she would send me her availability to have a phone call. And then because I said, would you like to chat further about it, like I did with Angaran? But then she never sent me her dates to get together. So
maybe we could also do 5. We could join. If there's someone else as well.
Oh, absolutely. Good. Yeah, great. So
okay.
I guess we'll just wait for people to send us their teams, and then what if there are any particular journals they wanted. And then I think we'll just have to redistribute the list.
Yeah.
Like Queens, for example, that's got to all be redone because Anna and I both left. So now there's Julianne on her own. So we'll have to kind of rejig things.
And Angaran seems like he's been doing it on his own.
He prefers to.
Yeah, that's
good. Because he's physically separate as well, right? He's at Lakeridge, so he's happy to do it on his own. He said.
And he's doing a great job.
I mean, he's
completely engaged, doing a great job.
Yeah.
And it's very good when he joins us as well.
Yes. Yeah. Okay.
Good.
Great.
Okay. Thank you.
Take care.
See you.
Bye.
Bye-bye.
Bye.